to NMP Talk Show, where we delve into the depths of mental health wellness with compassion, understanding, and expertise. Our goal is to provide a safe space for open conversations about mental health, destigmatize the issues surrounding it, and offer insights and resources to support your journey towards a healthier mind and soul.
Welcome back to NMP Talk Show. I'm your host, Neo Morapedi, and today we are joined by an incredibly insightful guest. Her name is Jenny Pena. Sorry. She's a renowned diabetic prevention health coach, and in this episode, we're going to explore a crucial connection between mental health and also diabetes management. Jenny will share her expertise on how our mental well-being influences our physical health, especially for those of us that are at risk, or we are living with diabetes. Whether you're looking for strategies to enhance your mental resilience or you're actually seeking ways to improve your overall health, this conversation is packed with valuable insight and it will help you. So let's dive in and learn more from Jenny on her knowledge about this topic. Jenny, welcome to NMP Talk Show.
Thank you so much for having me. I'm honored. I'm absolutely honored to talk about this topic.
We're the one who are honored here.
Oh,
So, Jenny, tell me, tell us a little bit about yourself.
Okay, so I live in New York currently, but I am Hispanic. My parents are from Dominican Republic, so I grew up in the Caribbean. And around my 20s, that's where like this whole journey and how I ended up being a diabetes prevention health coach started, because around when I was in my 20s, I was diagnosed with prediabetes. And I was not overweight. I didn't feel anything. I actually thought it was probably a lab error, and I completely dismissed it. Like I'm like, nah, it's probably like my sugar was a little elevated that day or something. I just completely dismissed it. But then later on, I started to find changes in energy, changes in focus, started gaining weight very rapidly. And when I went back to the doctor, the levels were even elevated, right? Like here we use a marker called A1C, which is a blood sugar test that will show the average glucose levels for a period of 2, 3 months. So it tells you if your levels are elevated most of the time. And that was even more elevated than the first time that the doctor had diagnosed me with prediabetes. So obviously, I had not very good eating habits and exercise. And that was that wake up call. She was like, well, if you don't do anything, before you hit 30, you're going to end up with diabetes. And there is a lot more complications. So I started doing the research and understanding, okay, like what is the root cause? What can I change? And I was put on medication and the side effects were horrible. Like I had a lot of GI symptoms, and I was thinking I cannot see myself living like this forever. And that created that passion to figure out, okay, what can I do? And I started asking my doctor and I started researching, then went to school to become a health coach. And I'm like, no, like I need to figure this out. And then when I was able to actually reverse or remission, I know that a lot of people use the terms, um,
Yeah,
but
remission.
I have been in normal levels for several years. I was able to completely eliminate medication, and I have been able to do it by adjusting how I eat, still enjoying the foods that I love, and practicing balance. So me seeing that, then I'm like, okay, like I went through the CDC program for diabetes prevention, so I'm certified to actually facilitate that program that is science based. And now that's my passion. Like I want to raise awareness and prevent others from doing the same thing that I did when they hear that warning sign of I am a pre-diabetic. And I have had a potential client say, well, I'm not diabetic yet. So they're actually like waiting until it gets to that point to make the changes when you're still at time to switch some of your habits and prevent it and be able to control that blood sugar.
Sure. So was it easy for you to change your lifestyle?
It is not easy because
Mm.
our brain is wired to
We are
practically correct
different,
you
right?
every time. If you're always used to,
Yeah.
it's very hard, right? Like because
Mm.
we're creatures of habit, we're used to certain things. But I would say, as a health coach, and that's what I do with my clients, it's like I know it's overwhelming because doctors will tell you, well, you need to lose weight, change your eating habits, and they give you very genetic things. And then when you're trying to do it all, it's just so overwhelming. And your brain naturally will actually, there is no neural path for that new habit that you're trying to incorporate. So I
Yeah.
always say, like, start with one thing, small shifts, and be consistent. And then you start building from there. And it could be just as simple as drinking enough water. If you are dehydrated, your blood sugar levels are going to be elevated.
Gonna spike. Mm.
Just,
This is something I just hate this being diabetic because a lot of things change in your life, and I mean just listening to your story, how you have to transform your life from that early age until now, where you're now very aware of what you're eating, of your
mhm,
diet, and just making sure that your sugar levels are okay. It's a struggle. We've got so many things that we have to face on a daily basis. For instance, work, family, just a lot of things. Now you have to add this on top of it. It's just it's just too much.
it
we
is, it
need
is.
we need something to change. Yeah.
And this is why there is the
Yeah.
connection with mental health and resilience.
Yes.
Because
Yeah.
now it doesn't just impact you, it impacts the family that you have around, it impacts your social life. Because now, maybe, again, a lot of us, all different cultures, we get very much connected through food
Yeah.
and
Yep.
changes in certain habits. It
Comfort food.
exactly, so it can be challenging, right? It's like, okay, like, me
Yeah.
being Hispanic, right? Like, we love rice and beans, and it's
Mm.
carb heavy. So
Yeah.
shifting that a little bit to eat differently while still
Mm.
incorporating those foods, it can be a process. But when you start seeing also the benefits and how you feel when your blood sugar is not going up and down,
Mm.
because it affects your mood swings, right? Like, a lot of people are thinking, like, well, you feel hangry, right? Like, not hungry, but
Yeah,
hangry.
hungry. Yeah,
Hungry
exactly.
and hangry. Why? Because typically what
Mm.
happens is
Mm.
you eat, let's say, food that will spike your blood sugar. The
Yeah.
pancreas has to start pumping insulin,
Yeah.
and then it drops drastically because pancreas is trying to be like, wait, this is a little too high. This is dangerously
Mm-hmm.
high. Let's bring it down. So
Mm.
then what happens is that's when you get what is called food coma. Some of my friends call it food coma. After you eat, you need a nap because you're
Mm.
feeling like your energy levels are down. That's all the
Mm.
insulin trying to control that spike after you eat. And then you feel like you have no energy. So your body automatically will pull into sweet stuff to give you quick energy because that's a signal that the body's receiving. It's like, well, I have no energy. I need more and I need it fast. So gravitating towards the starchy, the breads, the sweets, that is a natural reaction, but it
Mm.
creates that roller coaster. That's kind of like how I like to tell my clients. Like, I don't want you to ride the roller coaster. I want you to be
Mm.
nice, flat, and steady in your blood sugar.
Sure.
But it is challenging.
Yeah, we're happy we have somebody like you.
Oh,
Now, let's now marry these two aspects: mental health, wellness, and diabetes. How do they go together, or how is one affected by the other?
well, there is this connection, and not until not too long ago, I actually
Mm.
learned that there is something called diabetes distress. So there is an actual term for it,
What?
which
I need to write it
there
down.
is a term for it. And I'm like, wait, what? I knew the connection between stress. Well, stress levels actually spike your blood sugar. So even for individuals that don't have diabetes, if you're under a
Mm,
lot of stress,
mm,
hormones are high, it will spike your blood sugar. So
mm,
that's proven. But diabetes distress is just that burned out. Because you constantly have to manage this. And
mm,
depending on which stage you are in diabetes, whether you're having insulin, whether you're taking, metformin, whether you're taking a GLP-1 medication, everybody has a different protocol. Then you don't only have your primary doctor, now you have a diabetes team that you have to have a dietitian to give you instructions. You have an endocrinologist, right? It it is overwhelming and it's constant and it almost feels
yeah,
like it has no end. So
yeah.
I tell my clients, I'm like, well, everybody's different. I cannot guarantee that after you make changes, you will ditch medications. However, I can tell you that your life can be manageable. It can be easier to manage as you make these changes. But is that overwhelming feeling? Like taking the medication, what am I feeling? GI symptoms,
Mm,
right? Like if you're in a pickle and need to run to the bathroom at the inappropriate time or you're in the middle of a
mm,
meeting. And these are things that the medication causes, and it's a known side effect to some people. Having the anxiety, right? Like you having to measure your blood sugar constantly.
mm,
Sometimes you can get fixated and being like, oh, I created a spike. What do I do? Like, how do
mm,
I lower it quick? Then you feel that there's even a likelihood of you even developing depression because now you're feeling that your life is around diabetes, not just a part of your life. You feel like now you're just circling around diabetes and it controls everything you do from going on a social event. What do I eat? Am I going to get a spike? Do I have privacy to inject insulin? Right?
mm,
Like, are people going to be all over me? And that is the connection with it. Then you have the impact of just physiologically the blood sugar. When the spikes come, you are feeling out of focus. And when it drops, you're feeling anxious, you're feeling the fatigue. And that actually gets you moody because you're not having that steady flow of energy. So you
exactly.
become a little bit irritated easier. You can snap at people easier when you're managing these spikes. So all of that is connected. And then to top it off, you have the shame and the guilt. Because a lot of people will say, well, type 1 diabetes is something that has to do with your immune system, that somehow attack the cells that produce insulin. And then
Mm,
these individuals, they have to inject insulin pretty much for the rest of their life. Their pancreas cannot produce insulin.
yeah.
But with type 2, there is this term of this is a behavioral illness. So
Lifestyle.
and then what is saying indirectly is like, well, it's your fault. You
Mm,
created this.
yeah.
And while there is a lifestyle component involved, there are genetic components. There's certain ethnic groups that tend to have a high likelihood of it. There are other things that impact. So I would say mourn for a day. That's what I tell my clients. I'm like, okay, I know the news are tough. Take a deep breath. There are certain things you won't be able to control, and there are others that you can. Guess what? You can control and make changes on your exercise, on how you manage stress, even with all the things in your life. We all have stressors. The difference is how you manage those stressors. Like, are you journaling? Are you having some sort of a spiritual practice, right? Like, if you're a Christian, like prayer. Um, are you actually practicing some meditation? Like there are different things that you can do just to find that balance and build resilience
Mm,
because it is a lot. It is a lot. And
it is.
not focus on changing everything. I tell my clients, I'm like, you can't go from never walking to going to the gym 2 hours every day and completely shifting your eating habits. And now you only slept 5 hours, now you're going to sleep eight. Your brain is going to be in
It's gonna
shock
go
and
in a shock.
actually
Yeah.
tell you this is not what you typically do. You're wrong. and it's normal. That's what happens.
Sure. And everything happens up here, right? Mentally.
Yeah,
Yeah.
absolutely.
So now we do have a stigma we know that surrounds mental health wellness, right? If we speak about mental health, usually you would associate, or for those that have no idea, would associate mental health with someone who's cuckoo, who's crazy, right?
Sadly, yes. Yes, that's
Yeah.
the stigma.
So now, how do you think the stigma surrounding mental health impacts those with a chronic condition like diabetes?
Because they almost feel that they should be able to manage it without the support. And I'm here to tell you that it's okay to ask for the support. A lot of people, and depending on the cultures, they see going to a psychologist, going to a therapist, and they frown upon it. Like, oh, what is wrong with you? Like, do you really
Mm,
need to go there? And there's absolutely nothing wrong because it helps you process your emotions. In the end, that's the key. That's how you build the resilience. Um, and I know for my culture, that was like one thing that it was frowned upon. Now
mm,
people are changing their mind and they're becoming more aware that this is just a resource. And maybe you didn't go to a therapist, but maybe you had that best friend that you would vent out and call all the time, or you have a pastor. So support can look very different ways when it comes to mental health. Ideally, you want to get somebody that is prepared to give you the right support, like a therapist or a psychologist, but you can also get support from there are other individuals that can actually provide that because you are going through something major. It's a major event in your life,
mm.
and it doesn't make you less of a person or less of a value for needing that support, or and versus trying to, well, I'm just going to do this on my own. I don't need anybody, and I can handle it on my own.
So yeah, you actually touched on my next question to you about strategies that we can use as a coping mechanism, because like you're saying, at times we want to deal with the issue by ourselves, and not because we want to, but because we are forced to, because of the people around us with the stigma that's flying around. But now, you've mentioned that you can speak to somebody, ask for help, and I'm happy that we have professionals like yourself, who's a coach, to help people with diabetes or with chronic disease in general, that they can approach. But now, how do you now encourage somebody to go look for such assistance?
Well, I pretty much look at their own personalities, right?
Mm,
There are individuals that sometimes feel better having connection with other peers.
yeah.
If you're missing that social connection, because let's face it, there's some restaurants that after you become a diabetic, you're like, okay, it's very hard for me to sit here and find a meal that is not going to spike my blood sugar, right?
Mm,
It,
mm,
that let's face that. So if you're wanting that connection, finding a local group, finding some Facebook groups, even though you got to be careful, there are some groups out there that are a little sketchy. They have
yeah.
wrong information there. But finding a place that like minded individuals that actually relate to your struggles may be a very great thing. Now, if you are more reserved, if you feel like, okay, I feel scared of opening up, maybe finding a pastor, maybe finding a therapist may be a good choice. I know here in the US, there are some counselors that actually are part of your medical team the moment that you have a diabetes diagnosis. So it's a team effort of
Mm,
different doctors and different practitioners to give you that support. And one of it is that education, right? There are
mm,
some workshops, webinars. Sometimes they're like different, again, like the CDC has the National Diabetes Prevention Program that you don't even have to be a pre diabetic. If you have some of the markers of being high, you can register. And in a lot of these places in the US, they offer it for free. I don't know if it's in other countries, but there are a lot of resources out there that you can actually educate because I believe Half of it is just the shock and the social aspect. And let's say, okay, now your wife needs to modify how she's eating. Is she going to eat two things? Now she has like subtle things like that can create a high impact. So that's like one portion. But then the other portion is organizing all the ideas and all the information that is out there. And when you go to Mr. Google to ask, what should I do? And it has 20 different questions, 10 different diets. Yes, eat carbs. No, don't eat carbs. Yeah, but you only a little. Like there's just so much out there and a lot of conflicting information. You do intermittent fasting. No, you need to do keto. Don't eat bread anymore. It- It's overwhelming. So that can, if you don't even know how to move and you get paralyzed. So finding the medical advice that is science based, that you can find, okay, this is what works for me. Because
Mm-hmm.
I also believe in bio individuality. Like some clients thrive with intermittent fasting, others don't.
Mm.
So I always say, I'm like, okay, like you have to come with a learner's approach. Always look at science and then find the things that actually work and fit your schedule and then go with that. But that would actually clear a lot of the mental pressure and the overwhelm and processing it, not keeping, the overwhelming feeling. If you need to journal, I had some clients that are like, I don't write. I'm like, record yourself, vent out. If you're feeling frustrated, I'm frustrated. Why do I have to change all of this? And acknowledge those feelings instead of trying to hide them. Because then eventually they bubble up and they end up bubbling up in anger and you being moody
Mm.
and lashing out
And
at the people
also
that you love.
also affects your vitals then.
Yes, yes. And like it impacts because everything, it's the
Mm.
same thing with sleep, right? A lot
Mm.
of people are like, "Oh, a good night's sleep." If you actually don't sleep well for a couple of nights in a row, it impacts your insulin sensitivity, right?
Mm.
Little things like that.
Yeah.
But if you
Yeah.
try to make all the changes in one shot, it is overwhelming, and then the stress levels are going to go up, and that's not going to help either.
You mentioned Dr. Google. I must confess, I'm very big in going on Google on these AI apps. If I have a question, then I'll just pop it there. And one thing that I've noticed, and you just mentioned now, is that if you looking for, let's say, a diet for a type 2 diabetes,
Hmm.
you get so many responses that are different and you just don't know which one to go for. And you also have these talk shows about mental health, not necessarily mental health, but diabetes in specific. And this other person will talk and say, this is what can help you. And the other say something different. Then you get so confused. And what eventually happens is you take this from this one, that from this one, and you make your own. You become your own doctor, and which at times doesn't help. But thanks for highlighting that we need to be careful when, especially on things so important, that we need to seek professionals. And that's actually my next question to you, that how important is the healthcare providers to address mental health when they're treating patients with diabetes?
It is important. Sadly,
Mm.
some mental uh, health providers, the connection between that, well, there's the
Mm.
stigma. So depends on
Mm.
which country you are in the world. There may be a stigma or not. There's some doctors that either they see you for 5-10 minutes and they don't go through those thorough questions, right? They will give you the information about your lab work. They will tell you, okay, here's your medication. This is what you need to do. Take it 3 times a day. I'll see you in a month, two, six, whatever protocol it is. And they should ask, how are you doing? Do you have any questions? So I will even encourage, if your doctor is not that type of doctor that you can ask questions and they can explain to you in simple terms what is happening in your body, why you need to change your eating habits.
Yeah.
How does that even impact versus just giving the mandate, right? Like I love, even when I had it the first time, it's like, well, you need to exercise more and lose weight. How do I lose the weight, right? And
Yeah.
what does exercise more mean? It's very
Mm.
unclear.
And what type of exercise even?
And the thing is, like with exercise, like the CDC
Mm.
recommends you should exercise 150 minutes a day,
Mm.
and it actually
Mm.
has an impact on your mental health, because if you
Mm.
exercise, you're producing these endorphins and these hormones that are happy hormones.
Mm.
So incorporating a walk, I tell my clients, even after every meal, I'm like, even if it's 10 minutes, you had your dinner, involve the family. Go for a nice stroll. Go around the neighborhood 10, 15 minutes. That will balance your blood sugar. It will help you connect with your family, and it will help on your mental health. There's even walking meditations when you're walking and you're looking at nature and you can reflect
Mm.
on different things, find something to
Mm.
be grateful for. But sadly, medical doctors sometimes they don't have the time to do that. If they have the room full of patients out,
Yeah.
they're trying to get in and out, sadly, and I wish they would change. And that's why we bring advocacy. But there are other means for you to get that support. But sadly, sometimes they know the information and they just don't have the time to get to it and to really tap into how is this impacting you? Do you need a referral to go to a therapist, right? Like sometimes that conversation doesn't happen unless you bring it up. The doctors may not be able to bring that up.
Yeah. Sure. Thanks for this information. It's really helpful.
Mm, you're
Now,
welcome.
when we talk about a diabetic, usually what would consider in their diagnosis, and I'm not talking as medical professional here. I'm way too far from being called that one. But you're talking about blood levels, no, sugar levels, sorry.
Hmm. Hmm.
So, how do we have, what is the connection between blood sugar levels and the moods?
Okay, so when you have the blood sugar spike,
Yeah.
your vision gets blurry, you're out of focus, and you're feeling moody. Your body is not balanced. So that
Mm.
creates an anxiety, right?
Mm.
Even though there is no tangible reason for you to be anxious, you
Mm.
get like that, right? So what does the body do? It creates that insulin from the pancreas to try to lower it. So then when it gets too low, there's even, I had a client that would get panic attacks when it would get too low. And it all has to do with the hormone because insulin is a hormone and interacts with serotonin, interacts with all these other hormones that help you. It's the same thing with cortisol levels, right? Cortisol levels, they're supposed to have them elevated in the morning to wake up, right? To kind of like tell you, okay, be alert.
Yeah.
But going up and down, the cortisol levels start going up and down because it's all kind of like a puzzle. And if one it's elevated, then the other one is impacted. So
Mm.
that's why it's so important to try to keep it balanced. And that's why there is a risk of having a large meal. Typically, when you have a super large meal that is not very balanced, having protein, having fiber, having all the macro groups into it, what happens is your blood sugar spikes. And if you have been spending too long without eating, then the moment that you eat that food, that's another spike. So
Mm.
sometimes having consistent meals throughout the day will help and it will impact your mood. And it has to do with that hormonal connection.
Yeah. So now it impacts our mental well being, right? Sure.
I read an article
Mm.
and it was very eye opening in relation, which is why I actually, like with my clients, I promote balance. Like you will not hear me say eliminate carbs forever. You will not hear me say that just because you need carbs to produce certain hormones. The happy hormone, actually needs carbs to produce other elements within your body. So if you're
Okay.
not including carbs in your diet, you probably are having an impairment in creation of those hormones. So that's why having balance is
So you're less
key.
happy
Exactly.
because you're not
Exactly.
getting
You
happy
don't have that
hormones, right?
balance. You don't have that balance. It's the same thing with exercise.
Yeah.
Exercise creates those happy hormones.
Mm,
That's why spending time outside, connecting to nature, there is something about grounding yourself, right? Like putting your feet on the grass. There is just that connection with the earth that it relaxes you. And there are things that you don't notice. It's not one of those like deep moments, yet it
yeah.
does have an impact.
Let's rewind a bit to your story there. How did your did you receive enough support from your family? Because you know when you're going through this, the first time you learn of it, you get confused. You get all these emotions going up and down. You're thinking you're dying, or all of those things. Um, how can families, help you out when you are diabetic, and also your mental wellness as well? Because these things they go hand in hand. If
Mhm.
if you have a chronic disease, it affects your mental wellness because now you are thinking all these weird thoughts in your mind, crazy thoughts. How can families do uh, play a role there?
Well, the one thing that I would say, and I actually have a podcast episode that talks about if you know
Mm,
somebody with pre-diabetes or diabetes, like what not to do and what to do,
yeah,
which is interesting. But the
I'll
one
need
thing
to
that I
search
would
for that
say
one.
is, I'll give you the information. But
Yeah.
the
Mm,
one thing that I would say is give support without being condescending, right?
mm,
Without hovering over the food. What are you eating? Are you sure that's good? You know that that's not going to be good, but just be there for the
mm,
individual, right? Provide support. Ask, what do you need from me to
mm,
help you navigate this, right? Let that individual be the driver versus trying to impose. Well, from now on, you're not going to eat this, right? Like nobody reacts well to that.
mm.
But if you have
No, no.
somebody, if you have somebody that it's listening and it's like, okay, what can I do to help you? If you can get involved and let's say, well, let's try to redo this recipe that maybe we can find a healthier version that we can still enjoy as a family and make it a
Mm,
family event. Try to
mm,
build connections that are not necessarily around food. Or every time that you have something that, let's say like it's a holiday and you're having a large meal, incorporate something that involves movement. Have a little dance party with your family. Like help the individual feel included because just all these restrictions, it actually sometimes provoke them to get isolated. Like they
yeah.
don't want to be around people because either they're all over what they're eating, they're trying to give them counsel or guidance, or scold them because, oh, I told you that you needed to change your habits, right? So all that is a lot of pressure. So if you don't have the strength to manage all that, you isolate yourself and that actually ends up harming you. So if you know anyone, let them feel accepted, give them the support and ask them, what would you feel would be good for you? What do you need from me?
Mm,
And that will actually help them feel supported. That actually will help them own their journey and their decisions because nobody likes to be imposed to do things, right? Like you have
exactly.
to make
Yeah.
that decision your own. And
Yeah.
then let's say like you have your wife, okay, I really need your help with this. Can we try to develop a plan? Can you please cook this non-starchy vegetable as a side from now on? Like that way it can help me. Or could be even serving. Sometimes us women we like to serve a certain plate and we're like, okay, like now the plate should look this way. Help me that way. Or sometimes just listen, I am overwhelmed. Can you please give me a hug? Sometimes that it's all that that person needs to feel
Mm,
loved and feel calmed and feel like, okay, and it's not the end of the world. I also want to say that some people listen about the blood sugar levels and and they feel like, okay, that's it. I'm like, well, there are things that you can do to improve your life and not necessarily be a slave to the diagnosis. You can still enjoy your life and manage it.
You're not talking about family participation or involvement in this journey. My last podcast, we were talking about menopause, and the lady there expressed the diet. And when she explained a little bit on the diet, it more or less was the same as a diet for a diabetic, you know? So now we have a diabetic, let's say a husband is a diabetic, a wife is on her perimenopause or menopause. So in actual fact, the change of diet would suit both of them. And it would also bring them together, right?
Hmm.
Did I get it right?
Yes, you did. Yes, you did. And it's
Yeah.
easier, right? Like who
Mm,
like it becomes tough when you have to have two different types of diet. Whomever is cooking,
yeah.
whomever is grocery shopping, it's
Mm,
complex because you have to worry. But when everybody embrace and you find things that everybody enjoys and will actually support the health from everyone, because technically, you think
mm,
about the diabetes plate, right? Like that if you go to diabetes.org, you will find the diabetes plate. Half your plate should be non-starchy vegetables, a quarter of your plate protein, and the other quarter should be some sort of carb, preferably
yeah.
complex, right? Like with
Mm,
fiber. Um, I believe everybody should eat that way to
yeah.
maintain the balance. Now,
Balance.
there are some people, if you have insulin resistant and you eat a little more on the carby side, um, that may impact you more than somebody that doesn't have that insulin resistance. But
Mm,
eventually, it's something that if you do it often enough, it will impact. I remember for years, I worked on Wall Street, and for years, my breakfast was a large coffee with creamer that had sugar, and I added more sugar and I had a butter roll. That was my breakfast.
so much
And
sugar.
and now that I am a health coach, when I go back and calculate how much sugar that creamer and that coffee had, ideally you don't want to exceed as a woman 25 grams of added sugar a day. And for a man, it's about 38 grams. That had probably 45 to 50 grams. So I was
Sure.
doubling the daily allowance. And that was my first meal. And there was no protein, obviously no fiber there.
Yeah. Yeah.
So you're doing this, and obviously I drank how much like coffee all throughout
Coffee
the day
during the
because
day.
I
Yeah.
had no energy.
Yeah.
But I didn't know better, right? Like, and that's
Mm,
where like me bringing education and awareness and telling people, I'm like, okay, like the one advice that I tell everybody that I speak with when they book a clarity call and they talk to me, like, what is the one advice? I'm like, never eat carbs alone, even if it's a
mm,
fruit.
yeah.
Pair it with some protein, pair it with some fat. Don't eat it alone because technically carbs turn into glucose. So
But
it's a guaranteed spike.
but
It
but
may
then
be
those ones don't. Okay, let me rephrase. Don't they break down slowly?
they will break down slowly, but
Yeah.
the key is to combine it with something else. It
Okay.
is definitely better
Yeah.
to have fruit than to have a glass of juice,
Yeah.
right?
Yeah.
Because and it could be natural and there is nothing wrong. And I don't like labeling foods are good or bad. Foods are just foods. You just have to integrate them well.
Mm,
But when you pair them with protein, or even when you eat foods in a different order and you start with your protein and your vegetables and then
mm,
you eat the carbs, it will actually affect how the blood sugar spikes and you'll be
mm.
able to control it. Test it.
We'll definitely do
Test
that.
it. You're gonna see
All
it.
right.
I to this day, I mean, even though
Yeah.
I don't have a diagnosis, I'm not on medication, I
Mm,
still have a body that is prone, to have a spike. And I
yeah.
notice if I don't eat certain things in a certain way, I can feel it. I don't need a monitor to tell me.
Yeah.
I
Yeah.
feel the effects. It's that sort of high, like headache that you get, that you
Mm,
know that your blood sugar it's a bit elevated. Like
yeah,
only another
yeah,
diabetic, I still can't find a way of describing it, but only another diabetic can understand exactly what I say. And I'm like, yeah, it's that headache that you know that the blood sugar is a little elevated. But yeah, but that's definitely the trick. If you pair
yeah.
them and I tell them, okay, you want to avoid it, try not to eat it alone. Grab a piece of cheese, grab like a piece of like deli meat or turkey or something,
Mm.
but try to incorporate it with something else.
Oh man, thank you so much. I wish I knew you years back.
Oh. Well, I mean,
Yeah,
like we're now you're bringing a lot of
yeah,
awareness, which is great, and that's what we need. That's what
yeah,
we need.
exactly. Mm.
When it comes to
So,
statistics, like right now in the United States, 1 in 3
mm,
have prediabetes,
mm, sure,
and 80% of them have no clue. By the time they find out is when
it'll be too
something
late.
major happens. So that's why
Yeah,
monitoring your glucose, going to your doctors if possible, and getting that monitored. And if you're
for
seeing
medical.
these subtle changes, take action. Because the sooner you start making changes, the more likelihood of you being able to prevent it or even delay developing diabetes. So that's so important.
So let's help out. Let's help people out there, right? What support resources, would you recommend for somebody who's struggling with these issues?
Okay. So
Mm,
if you're talking about mental health,
yeah.
I would say find a therapist, a pastor, somebody that can listen to you so that help you process the emotions. Obviously, I will
Mm,
prefer that you get a professional. However,
mm,
sometimes you just need some safe place. Find that safe place that you can process that. If
mm,
you don't have somebody to process that, use journaling. Try to find a peer group. That
mm.
sometimes listening to what other struggles makes you feel not alone on the journey, and that may
Okay.
help.
So we're
Um,
talking about mental,
mental,
mental. Yeah.
right? Like those are
Okay.
the mental tips that I'm sharing
Okay. Yeah.
to manage that. And I would even say that this is not just for diabetics. Like this is for anybody that is dealing with a chronic illness, something that is major, that is
Mm,
impacting your life. These are things to do. Find one thing every morning that you're grateful for and be thankful for that. And say, okay, I'm grateful for this, right? Like you wake up this morning, you're breathing, or you have a roof. Find something and that will change your attitude. And now, when it comes to diabetes, I would say
mm.
tap into resources from reputable organizations, right? Like the CDC or diabetes.org, or find a health coach like me. Like some people like reach out to me for help.
Yeah.
Find diabetes educators, right? Like there are different support systems that will help you. A dietitian will help, right? Depending on where you are with diabetes, they may be able to assign how many carbs each meal should have and all of that. So there's a lot of support you can get there. But if there's like a few tips, drink lots of water. That's good for health. Make sure you're having balanced meals. Follow that plate, right? Like don't eat just a plate of rice,
Certain
but
group.
add some
Yeah.
lentils in there, add some protein in there that you have available, and balance it. And incorporate exercise. It will help with mental health and with your blood sugar, especially if you add it right after your meal. If you do right after your meal, a simple 10-minute, 15-minute walk, call your wife, your husband, your friend, and go on that leisure walk. It will do great benefits, not just on your mind, but also on your body. And stress, that it's also related to all the mental health tips that I shared, and sleep. Because if you don't sleep well, your moods are going to go up, your blood sugar is not regulated, and you're probably going to snap out at people,
Yeah.
and you're not going to have that high tolerance to deal with whatever stressor may come your way.
Sure. So people with diabetes, right? How can they advocate um, for their mental health needs? when they are with healthcare, in fact, in their healthcare system?
It's just having a voice.
Mm,
Having a voice. I know that some insurance companies sometimes, like now, I know here in the United States there are a lot of changes even in policy and coverage, because
yeah,
sometimes there was a limitation, like what do you do when you cannot afford this and the insurance is saying you don't need it. So speaking up, if there is anything in your city or in your country that you can speak up, even legislations, like there's a lot of advocacy groups that you can get involved. I would say get involved and speak out, and start with your doctor. If you speak to your doctor and you're like, okay, like I really feel that I need the support, this will help me a lot,
mm,
I highly doubt that a doctor will not try to find a way of getting you a professional to help. So that's what I would say.
sure. These are very helpful tips, very insightful, and you can tell that you've been through this journey. It's
Yeah, and,
different.
and I love
Yeah,
talking about it and bringing awareness. So this is like
yeah.
a passion that I have.
It's different when you have to, I don't know, diagnose or speak about a certain illness and you have not experienced it, compared to somebody who's going through it.
Mhm.
And I've had another doctor on the show. We were talking about arthritis, and she also had one. So the way everyone speaks about it, you speak with passion. You speak of how you can deal with it. You understand your patient, and that's what I appreciate about professionals like yourselves, that have gone through um, the illness and also are able to stand out from it and champion ways on how you can deal with it. And I really do appreciate it.
Yeah,
So thank you so much for sharing these insights. And I know the audience there out there will really benefit a lot from it. And we're hoping that we're gonna get some feedback out of this discussion, questions. And if we do, we'll send them to you, Jenny, so
absolutely,
that you can
absolutely.
answer. Yeah.
My pleasure
You.
to bring awareness and get people to
Yeah.
understand that there are things that they can do to
Mm,
prevent, that there's the things that they can do to manage the news
yeah.
and process it,
Mm,
and have a joyful life, full life, right? That we all deserve. It shouldn't
true.
be the diagnosis being the center of your life. The diagnosis should be one portion of your life. You should still enjoy your life.
You also mentioned off camera that you do have training, or is it seminars? Did you say
I
that you
try to
offer?
have at least one workshop a month,
Workshop. Yeah. Yeah. Okay.
and I offer it for free, and it's just a workshop. Like now, the one that I'm actually, like, I have it next week, exactly 1 week from today,
Yeah.
that covers how you're building your plate, the things that you can do to manage sugar cravings. Typically, sugar cravings come from individuals that maybe you didn't eat enough protein during the day, or you're skipping a
Mm-hmm.
lot of meals, and then towards the end, the body is just trying to catch up with energy levels. And again, quick energy comes with carbs. So you're going to try to go for those sugary stuff, the donuts, the sweets, the pastries, all that good stuff. And that is something that I'm actually doing like next week. And this is my second time, and a lot of people have been benefiting from it. I'm getting a lot of good feedback because it has some strategies that you can just
Yeah.
start applying right away, and they see the difference in focus after they apply those
Awesome.
strategies.
Awesome. So how do we now get the link to that?
Sure. I can definitely
Yeah.
get you the link to it, but you
Yeah.
can also go to my webpage,
Yeah.
www.jennypena, that's JENNYPENA.com. And over there is a form that you can fill out and register. It is absolutely free. I just need to you to register so you can get the Zoom link and join.
Yeah.
And
Okay.
yeah, that's pretty much it.
Awesome. Do you have patients or clients that are consulting with you out of the United States?
I don't have currently. However, I
Mm.
can have individuals
Or
from
you can
outside.
have. Okay.
I
Because
am
we're
certified.
podcasting from South Africa, and whoever's listening here would really love to maybe connect with you.
Yeah,
So
absolutely.
at least that part is sorted.
Yeah, absolutely.
Awesome. Thank you so much, Jenny, once again. And we'd
Thank
like
you
to
so much.
thank everyone that has connected, who also are watching this recording. We thank you for taking your time to listen to these insightful information that we just gathered from Jenny Pena. And we hope that you find the discussion enlightening and that it inspires you to prioritize both your mental and your physical health. Remember, taking small steps can lead to a significant change in your health journey. Stay tuned for more as we engage this type of conversation with professionals like Jenny that she did today. And until next time we meet again, we're looking forward to hearing from you, commenting, and just being part of this discussion, making an awareness throughout there about our mental health and other sicknesses that we may be facing and how to deal with them. My name is Neo Morapedi, the host of this podcast, and I'm looking forward to seeing you next time. You need internet? You need